Your radiological diary. Today we will study about lungs. As we know, lungs is the basic part of our body which fulfill the requirement of breathing. Mainly, we will discuss lung anatomy, then further and about pathologies and modalities which used to diagnose the lung pathology. This is the picture showed you the basic anatomy of lung. As you can see, is the thyroid cartilage. At that level, the thyroid gland is located. Then cricoid cartilage, and this one is trachea. Right part of the lung and the left lobe of the lung. And right lobe is divided into three lobes: upper lobe, middle lobe, and lower lobe. Left lobe is divided into two parts: upper lobe and lower lobe. Trachea is dividing into right primary bronchus and left primary bronchus, or left lower bronchus. Further, we will study about radiological anatomy. As shown in picture, there is a rib cartilage in light gray color, and a darkish gray show the lung. And it's a CP angles. These are CP angles, and this one is clavicle, and this one is scapula. We can see the thoracic vertebrae. It is the apex of lung, and this one is cardiac part. It is right ventricular and left ventricular. Right atrium and right atrium and left atrium are located there. And the main part is aorta, which dividing into three parts: left subclavian, left common carotid, and brachiocephalic artery. And this one is the right pulmonary trunk, which is further divided into two brachiocephalic veins. Left brachiocephalic vein is divided into subclavian vein and interjugular vein, external jugular vein. Similarly, we can see the posterior part of the pulmonary trunk. Posteriorly, there are two arteries and one vein. Right pulmonary arteries, two are right pulmonary arteries and two are left pulmonary arteries. While in the right side, there are right pulmonary vein, and the left side, two left pulmonary veins. Basically, it's a normal X-ray, and the structures mentioned above, these are the basic structures we can see during the reporting of X-ray. There are some pathologies we can easily see, like a lobular consolidation. As we can see, the upper part, only one lobe of the right lung, or the upper part of the lobe, is affected by consolidation. What is consolidation? Consolidation is a solidification. Solidification means due to accumulation of any solid or gas, there is an obstruction. This is called the consolidation. So it's a lobular because it's affecting the one lobe of the right lung. Diffuse consolidation, it is affecting the many lobes toward the right and the left. So this is called the diffuse consolidation. Multifocal, ill-defined. As we can see, there are some abnormalities on this chest X-ray. This is multifocal, ill-defined. It can be any mass or alien. Atelectasis. Atelectasis means collapse of lung. In the absence of gas exchange, we can see one lobe of lung is collapsed, and it is unable to exchange the gases. So it is usually atelectasis is usually unilateral. Fine reticular interstitial. It's a fine reticular interstitial fluid. Coarse reticular. As we can see, it is only located on the CP angles. fine nodular and solitary pulmonary nodules like this in this chest X-ray, and multiple masses are we can see in this X-ray. Further, how we can diagnose these pathologies and the function of the lung. There are so many imaging modalities which is used to diagnose any pathology. Chest radiography. X-ray is simply included into the chest radiography. Its advantage is it's very low dose ionizing radiation, cost effective, is very cheap, and widespread availability. I mean, it can easily available anywhere. And disadvantages, inner and we can't see inner and inter observation or agreements, poor sensitivity and specification. Because we know chest X-ray is not a detailed scan, so this is the basic disadvantage of chest X-ray. Ultrasound perform at bedside, free of ionizing radiation, and effusion before X-ray, ability to see abscess or pulmonary extrapulmonary tuberculosis, sensitivity specifications for the data sign, and unable to assess pulmonary hilar for lymphadenopathy. And CT, no doubt, it's a basic and very well defined and detailed scan for chest. We can see just in very small millimeter slices from CT scan and the magnetic resonance imaging. The basic disadvantages or disadvantage of CT is it's expensive and it's very high ionizing radiation. Magnetic resonance imaging differentiate the TB lymphadenopathy from the lymph nodes and the basic signal of the interstitial. It's very expensive and it requires specification. Magnetic resonance imaging, there are so many moving artifacts in during scan, so it's not good for chest. And further, sometime we commonly used to see elevated abdomen in chest X-ray. We'll see its image in next slide. Cause of elevation, maybe it can be incomplete inspiration, overweighted, pregnancy, hypomegaly, or enlargement of liver, reduce the volume of the lung, and subphrenic abscess. As we can see, it's it's elevated abdomen. It's an X-ray with so many patches and with the high infection. It's showing the COVID positive. Lung collapse. As you can see, lung is totally collapsed in this image. There are so many more X-rays which can clear our concept. Atelectasis, unilateral and it's unilateral and collapse of one side of lung. Cardiomegaly, increase the heart size. Effusion, accumulation of fluid, infiltration, masses, nodules, pneumonia, pneumothorax. Further, you guys can tell me what is this in this X-ray in comment section. Thanks for watching the radiological diary. Please like, share and comment.